Hey guys, so I think that it would be kind of fun to talk about clinicals because that was kind of what I was most nervous about before starting nursing school, and I just kind of didn't know what to expect. So I think it'd be kind of fun just to talk about surviving clinicals and how to make the best out of your clinicals, because with looking for a job and all, that's usually where you gain the most skills. You know, you sit in class for however many hours a day, and yeah, you learn stuff, but you really won't understand how to put a Foley catheter in or how to insert an NG tube until you actually do it in a clinical setting. So I just think that would be kind of fun to talk about them and my tips for surviving them. So if you think that this is a video that you would enjoy, I hope you stay tuned. So starting off, I think sleeping is very important, especially when you're in school, and not only when you're going through clinicals, but school in general. But if you don't get enough sleep the day before a clinical, it just makes your day really difficult. I remember, like, I would get really anxious before clinical and then I wouldn't be able to sleep. So I would go into clinical and just be so exhausted and just not feeling it for the day. And that's just not a great learning attitude. And I really went out of my way as nursing school progressed to get more sleep, especially before clinical. It is a long day. You're starting very early and you're doing a lot. So if you can get a good night's sleep before that, then you're really setting yourself up to do well that day. So I remember for my psych clinical, it was at night, and I know that every Friday I would treat myself to something out of the cafeteria, so I wouldn't pack a lunch. But I think treating yourself, especially at the end of the week of a clinical, I think that that's really, you just kind of pat yourself on the back and you made it through a clinical and you made it through another week. And I think it's really important that you treat yourself, whether it's dinner or maybe coffee, whatever you like, and making that, a little bit of a treat and an end goal for that week. I think that that's something that you really are able to reward yourself with. So usually how clinicals work is mine, since I was in an accelerated program, my clinicals were very short, so we had like 7 weeks for each clinical, which is very quick. But usually, generally, I guess, you are with a different nurse each day, because it just, you're assigned a patient and it just depends on what nurse has that patient. So it could be this nurse one week, or you could be with this nurse the next week. It all depends. And my recommendation is trying to get a different nurse, if at all possible, just because. And again, I went to a pretty big hospital, so there was a lot of nurses, and I never was with the same nurse each time, but if you really can go out of your way to get a different nurse each week, you're able to see how they organize their time and how they do things differently, because not one system's going to work well for you. You need to, as a student, test out different systems and see how each nurse organizes their time and decide which way best works for you. And honestly, I was with some nurses who I was like, I don't want to be a nurse like that when I get older. You see what you want to be like and you see what you don't want to be like as a nurse. And I think that that's really important and really reflective for you as a student. So yeah, like I said, I would think I was with a different nurse each day for each clinical, which I was really thankful for. I think if you're in a little bit of a smaller hospital, that might be difficult, but yeah, that's a big tip that I have, is just to try and get a different nurse and see how they organize their time and how they interact with patients, and make your own decision if that's the kind of nurse that you want to be. A good bag is very essential, especially in nursing school. What I did is they actually provided us with just like a bag, and I just used that as my clinical bag. So I would have it packed I would pack it the night before for clinical, and I'd have papers that I would use for clinical, my stethoscope, blood pressure cuff, a ton of those alcohol swabs. I use those a ton. I usually had a pen light, some pens, some black pens. I had like, I think at one point I counted I had like 25 pens, but you know how that is. People are always asking you for pens and you lose them and they never give them back. So definitely have enough pens. I'm trying to think what else. You'll develop your own kind of nursing bag and clinical bag. You'll see what things that you reach for all the time. I'm trying to think what else. That's pretty much it. Alcohol pads, for some reason I would go through like so many in a day, and I would always need them. So even if you bought your own, I know that the hospitals have them obviously, but I think I bought my own, and I would just always keep them in my bag because you were always reaching for them. So just having a good bag makes you feel more prepared and more responsible and ready to take on that clinical day. And it just kind of, if your bag's packed, I felt like the days that I wasn't prepared for clinical were the days that I did not pack my bag the night before, and I felt like I didn't have anything. So yeah, I think that that's a really big tip for surviving clinicals, is having a very good bag. I think this next tip kind of speaks for itself, but doing and seeing as much as you can in clinical is super important. You really want to make the most out of clinicals, because once you graduate and once you're a nurse, like, you're going to come across situations that you're thinking, oh my god, I wish I would have seen that in clinical, or I wish I would have done that in clinical. Mine, for example, is I know I'm going to have to insert an NG tube, but I have never done it on a real person before. I've seen it done, but that was my first day as a nursing student. And so, you know, I wish I would have had that opportunity to do that on a real patient and not necessarily practice on them, but really get the hang of what I'm doing, because obviously I know how to do it, but it's very different on a real patient than it is on the mannequin in lab. So I know some people had inserted Foley catheters before, and luckily I was in the operating room, so for my transitions placement, so I was able to do a lot of Foley catheters, but they were all the patients were sedated, so, you know, I couldn't. It's very different inserting a Foley catheter on a sedated patient versus a conscious patient. So it's different stuff like that that I really recommend that you really try and do and see as much as you can. You may be tired, you may be annoyed that you're with this nurse, or you may be annoyed that you're with this other student, but really making the most out of that clinical experience is going to help you as a nurse, and it's going to allow you to provide better care for your patients, and not only better care but safer care, which is most important. And until you actually do it, it just, you know, you're going to become more comfortable with it and practice. You know, that's how we get good at things, is we practice. So my last tip that I can kind of think of is eating before clinical. So many, I would be shocked with how many of my fellow students would show up clinical and not eat breakfast, and then they get sick or they get lightheaded during a procedure or something. So, you know, it sounds kind of stupid, but please eat before you go to clinical, because it is a long day and it's an early day, and you know, you're doing a lot with a lot of different things, so you don't want to feel like you're going to pass out or become lightheaded. I think I would always just grab like a Cliff Bar. I would always eat like a Cliff Bar, or even just cereal in a little baggie. Those are kind of my two go-to breakfasts. I also had an hour drive to school, so that would allow me to eat in the car on the way there. But yes, please eat before you go to clinical. I'm sure your clinical instructor will tell you that as well. But it's really important, and you know, and I know that when I don't eat, I get very hangry, as they call it nowadays, and I get a headache, and that just sets me up to be not a very pleasant person, and I don't want to be that kind of person or that kind of student who was just always annoyed or, you know, complaining of a headache. I wanted to be the student who was always willing to learn. So yeah, that's my biggest tip, is eat. Please eat before you go to clinical. So I hope that you guys enjoyed this video. Just, clinicals are hard, and clinicals can make you feel like you don't know what you're doing, but you know more than you do, and I always felt like that. I always felt like I just don't know what I'm doing here. I felt kind of stupid in front of these nurses, but always just remember that they were once in your shoes, and if you're not having a good experience with a nurse, please tell your clinical instructor and try and work something out, because you want to make this experience the best learning experience. And if they're not doing their job, then, you know, go find another nurse or talk to your clinical instructor, because they're there to help you. So yeah, I hope you guys enjoyed this video, and I hope you found it helpful. And I will talk to you guys later. Bye!